What I'm about to share with you goes against everything most men have been told about improving their performance in the bedroom. In fact, the third method I'll reveal today is so rarely discussed that even most doctors don't know about it. Yet it's been quietly transforming the lives of men in their 50s, 60s, and beyond. If you've been struggling with confidence issues, feeling like your body isn't responding the way it used to, or if you're tired of relying on pills that come with side effects, then stay with me because today we're diving deep into 3 scientifically backed methods that can help you reclaim your masculine vitality naturally. I'm here to give you the honest truth about men's health that nobody else wants to talk about. This isn't about quick fixes or miracle cures. This is about understanding your body, respecting the science, and taking control of your health in a way that actually works. Before we begin, let me ask you something. When was the last time a doctor sat you down and explained the real mechanics of how your body works? When did someone tell you that there are natural, proven methods that can help you improve erection naturally and boost confidence without depending on medications for the rest of your life? The reality is, what we call erectile function is fundamentally about blood flow. Think of it this way. Your heart pumps blood through a complex network of highways and back roads throughout your body. When it comes to achieving and maintaining a strong erection, we're talking about a very specific route that blood needs to take, and it all starts with your cardiovascular health. The blood that reaches your penis travels through increasingly smaller vessels, beginning with your internal iliac artery, which branches off from your abdominal aorta, essentially your body's main highway for blood flow. This internal iliac artery then splits into what we call the internal pudendal artery, and this is where things get interesting for men's health over 60. This artery gives rise to even smaller branches, the cavernous arteries, the penile artery, and the dorsal artery of the penis. These tiny vessels are responsible for delivering that oxygen-rich blood that creates a firm, satisfying erection. Now, here's what most men don't realize. If these pathways aren't functioning optimally, no amount of wishful thinking is going to help. But the good news? There are proven ways to improve this entire system naturally. This is exactly why medications like tadalafil and sildenafil work. They're vasodilators, meaning they help open up these blood vessels to allow better flow. But what if I told you that there are natural methods that can help improve this same vascular health? What if you could enhance the irrigation of your pelvic circulation without relying solely on pharmaceuticals? That's exactly what we're going to explore today. The first method I want to share with you involves strengthening muscles that most men have never even thought about, yet they're absolutely crucial for sexual function. I'm talking about your pelvic floor muscles, and the exercises that target them are often called Kegel exercises, though I prefer to call them pelvic floor strengthening exercises because that's exactly what they do. Now, before you think this is just for women who've had babies, let me stop you right there. Your pelvic floor muscles are involved in virtually every aspect of your sexual function, from the quality of your erections to the control you have over ejaculation, and even your urinary continence. These muscles form a supportive network at the base of your pelvis, and when they're strong and responsive, they contribute significantly to better blood flow and overall sexual performance. Here's how you can locate these muscles, and I want you to try this the next time you're in the bathroom. When you're urinating, try to stop the flow midstream. Feel that? Those muscles you just engaged. That's your pelvic floor. Those are the exact muscles we want to strengthen and condition. Don't worry if you can't stop the flow completely at first. This takes practice, and it's actually a sign that these muscles need some attention. The technique is straightforward, but consistency is everything. I want you to contract these muscles and hold for 5 seconds, then relax for 5 seconds. That's 1 repetition. Start with a set of 10 repetitions and aim for 2 to 3 sets per day. Now, here's the crucial part that most men get wrong. You need to commit to this for a minimum of 6 weeks to see real results. This isn't a quick fix, but it's a permanent improvement to your sexual and urinary health. The beauty of these exercises is that you can do them anywhere. Sitting at your desk, driving in traffic, watching television, nobody will know you're working on improving your intimate health. But here's what I've learned from working with men over the decades. The ones who see the most dramatic improvements are those who approach this systematically. Consider keeping a simple log for the first few weeks. Note when you do your exercises, how the contractions feel, and any improvements you notice. If you're going to try these pelvic floor exercises, I want you to promise me something in the comments below. Write, "I'm committed to 6 weeks, so we can support each other in this journey." There's power in making that public commitment, and I'll be checking the comments to cheer you on. Now, while you're building that foundation with pelvic floor strength, let's talk about the second method, which is something called vacuum therapy or penile pump therapy. Now, I know what some of you might be thinking. This sounds like something you'd see in a late-night infomercial. But let me tell you, this is legitimate medical therapy that's used in rehabilitation protocols, especially for men who've undergone prostate surgery or who are dealing with vascular issues affecting their erectile function. Vacuum therapy works on a simple but effective principle. It creates negative pressure around the penis, which draws blood into the erectile chambers. Think of it like priming a pump. You're encouraging blood flow into areas where it might not be flowing optimally on its own. This isn't just about achieving an erection in the moment. When used consistently as part of a rehabilitation protocol, vacuum therapy can actually help improve the overall vascular health of the penis. The device itself is relatively simple. It's a cylindrical chamber that fits over the penis, with a pump mechanism that removes air to create that negative pressure. You can find these devices online, and they come in both manual and automatic versions. Generally, the automatic ones are more user-friendly, but here's my strong recommendation. Before you purchase anything, consult with a healthcare provider or a physical therapist who specializes in pelvic health. They can recommend the right device for your specific situation and, more importantly, teach you how to use it safely. Safety is crucial with vacuum therapy because improper use can cause complications like bruising, pain, or even tissue damage. The protocol typically involves using the device for 10 to 15 minutes, 2 to 3 times per week. Some men use it daily, but never for more than 15 to 30 minutes to avoid causing harm to the delicate tissues. Some protocols also involve using a tension ring at the base of the penis after removing the pump to help maintain the erection. But again, this requires proper instruction. What's particularly interesting is that some studies have shown that combining vacuum therapy with medications like tadalafil can produce better results than using either approach alone. It's like you're attacking the problem from multiple angles. The medication helps with blood vessel dilation, while the vacuum therapy provides mechanical assistance and may help with long-term vascular conditioning. Have you ever heard of vacuum therapy before today? If this is new information for you, let me know in the comments. And if you're considering trying this approach, write "vacuum therapy interests me" in the comments so I know this information is helpful. Now, here comes the third method, and I'll bet most of you have never heard of this one. It's called penile extender therapy, and while it might sound like something from a questionable website, it's actually a legitimate therapeutic tool used by physical therapists and urologists in sexual rehabilitation protocols. The science behind this is fascinating and based on the principle of tissue remodeling through controlled, sustained traction. A penile extender is a device that applies gentle, consistent stretching force to the penis over extended periods. Now, before your mind goes to uncomfortable places, let me explain how this actually works from a physiological standpoint. When tissue is subjected to controlled, sustained stretching, it responds by developing new blood vessels, a process called neovascularization. This improved blood supply can enhance erectile function, and in many cases, it can also result in some degree of length increase. The research on penile extenders is actually quite compelling. Studies have shown that when used for 1 to 2 hours daily over a period of 3 to 6 months, these devices can contribute to improved sexual function, better erection quality, enhanced penile vascularization, and yes, some degree of lengthening in a significant percentage of users. But here's the key. This requires dedication, proper fitting, and gradual progression. This isn't something you just order online and start using at maximum tension. The device needs to be properly fitted to your anatomy, and the tension should be gradually increased over time according to a specific protocol. This is why I strongly recommend working with a healthcare provider who's familiar with these devices, at least initially. They can ensure you're using the right size, show you how to adjust the tension appropriately, and monitor your progress to prevent complications. The typical protocol involves starting with shorter sessions and gradually building up to 1 to 2 hours of daily use. Many men find they can wear these devices while working at a desk or during other sedentary activities. The key is consistency over months, not weeks. This is a long-term investment in your sexual health, not a quick fix. What I find most encouraging about penile extender therapy is that it addresses the root cause of many erectile issues: poor vascular health in the penis. By encouraging the development of new blood vessels and improving tissue quality, you're essentially giving your body the tools it needs to function better naturally. If you've never heard of penile extender therapy before, you're not alone. Comment below and let me know. Is this completely new information for you? And if you're someone who's tried this approach, I'd love to hear about your experience. Your story might help other men who are considering this option. Now let's talk about putting all of this together, because the real magic happens when you approach your sexual health holistically. Think of these 3 methods as legs of a stool: pelvic floor exercises building the muscular foundation, vacuum therapy enhancing blood flow and vascular conditioning, and extender therapy promoting long-term tissue health and vascularization. The men who see the most dramatic improvements are those who commit to a comprehensive approach. They understand that sexual health isn't just about what happens in the bedroom. It's about cardiovascular health, muscular strength, psychological confidence, and overall wellness. These 3 methods work synergistically. The pelvic floor exercises improve your muscular control and support. The vacuum therapy enhances immediate blood flow and provides vascular conditioning. The extender therapy promotes long-term tissue health and development. But here's what I want you to understand above all else. This is about reclaiming your confidence and your vitality. Sexual health is an integral part of overall health, especially for men over 40, 50, and 60. You don't have to accept decline as inevitable. You don't have to rely solely on medications that might come with side effects or limitations. I want to address something that many men struggle with, but rarely talk about: the psychological impact of sexual health issues. When your body doesn't respond the way it used to, it affects more than just your physical performance. It impacts your confidence, your relationship with your partner, and your overall sense of masculinity. These natural methods aren't just about improving physical function. They're about restoring that sense of control and confidence that comes from knowing your body is working optimally. If you found this information valuable, I want you to do 3 things for me. First, hit that like button to let me know this content is helping you. Second, subscribe to the channel and ring that notification bell, because I'm committed to bringing you honest, science-based information about men's health that you won't find anywhere else. And third, share this video with a friend who needs to hear this message. You might be surprised how many men are dealing with these issues in silence. Remember, improvement takes time, but it's absolutely possible at any age. The men in their 50s, 60s, and beyond who see the best results are those who approach this with patience, consistency, and the right information. You have more control over your sexual health than you might think. These methods we've discussed today aren't just theories, they're proven approaches that have helped thousands of men improve erection naturally and boost confidence in their intimate lives. Your age doesn't define your limitations. Your past doesn't determine your future. What matters is what you choose to do starting today. Whether you begin with the pelvic floor exercises, explore vacuum therapy with proper guidance, or investigate penile extender protocols, the most important step is the first one. Take control of your health. Take control of your confidence. Take control of your future. You deserve to feel vital, confident, and satisfied with your intimate health, regardless of your age. The science is on your side. And now you have the knowledge to make informed decisions about your sexual wellness. Thank you for trusting me with this important conversation. I'm here to support you on this journey, and I'll be back next week with more honest, practical advice about men's health. Until then, take care of yourself, be patient with the process, and remember, it's never too late to improve your health and reclaim your confidence.